In this video, we talk about the hidden connection between your prostate and your sex drive, and how it might explain the gradual changes in desire, performance, or confidence many men experience after 60, and how you can support both with safe, medically sound steps. Make sure to watch until the end, because what we cover might just open your eyes to what's really going on beneath the surface. You don't feel quite the same level of drive or desire that you once did. It's not completely gone, but it's dulled, less spontaneous, less consistent. Sometimes you still want intimacy. Other times, it just doesn't cross your mind. And that difference might be subtle, but it's unsettling. At the same time, you've probably noticed a few changes in how you urinate. Maybe your stream isn't as strong, or you're waking up once, maybe twice, maybe more during the night to go, or perhaps it just takes longer to start or to fully empty. Now here's the part that's important. Most men assume these are two separate problems. They think, well, I'm older now, so of course I'm not as interested in sex. And also, well, of course I'm getting up at night. That's just what happens with age. But what if those two changes were actually connected? What if your declining sex drive and your prostate symptoms were part of the same story, rooted in the same biological changes? Most men are never told that. That's partly because our culture doesn't make this easy to talk about. Libido is still treated like a mysterious, awkward topic, and prostate problems, even though they affect tens of millions of men, are often brushed off until they become disruptive. That silence leaves too many men confused, isolated, or misinformed. And when you're left guessing, you tend to blame yourself, or you tell yourself it's just normal aging, or you start to wonder if something's wrong with you, even if you'd never say that out loud. But here's what I want to share with you today. There's a deeper connection between your prostate and your sex drive, and once you understand how they influence each other, it opens up safer, smarter ways to support both. Now, to be clear, there's no one-size-fits-all answer. Every man is different. Hormone levels, medications, stress, relationships, they all play a role. The pattern is real, and it's more common than most people think. Now, we'll go much deeper into the specifics in just a bit, including how hormones like testosterone interact with the prostate, how medications can change your experience of intimacy, and why stress and sleep play bigger roles than most people realize. But first, it's important to understand something fundamental. You're not broken. You're not past your prime. You're not just losing interest because of age. You're adapting. Your body is shifting in ways that are biologically normal, but often misunderstood. And when we treat these changes like isolated problems instead of part of a bigger picture, we miss the opportunity to support men in a more complete, respectful, and effective way. So if you've been quietly wondering why your drive feels different, or why certain medications seem to affect your interest or performance, or why you just don't feel the same way you used to, you're not imagining it. You're simply noticing what happens when a man's hormonal, neurological, and urinary systems start sending signals, often at the same time. Let's start by talking about some of the most common myths men hear, and what the science actually says. First, there's this idea that losing interest in intimacy is just part of getting older, that it's inevitable, irreversible, and somehow normal. It's one of the most widespread assumptions I hear from men in their 60s, 70s, even 80s. But while it's true that certain changes in hormone levels and circulation occur over time, it's not true that you have no control or that desire simply disappears. The reality is more nuanced and more hopeful. What many men don't realize is that libido and prostate health are deeply connected, and that connection is both physical and hormonal. Let's look at a few facts. Your prostate isn't just a passive organ sitting in your pelvis. It plays a direct role in your reproductive and hormonal systems. It surrounds part of your urethra and sits just below the bladder, but its influence extends much further, especially when it comes to how your body processes testosterone, nerve signaling, and blood flow. So when your prostate becomes enlarged, whether from benign prostatic hyperplasia, BPH, or other causes, it can disrupt more than just urination. It can affect how you feel, how confident you are, and even how well your hormones are functioning. And here's where things get more interesting. There's a long-standing myth that once your prostate begins to act up, once you're dealing with frequent urination or getting up at night, your sex life is basically over. That belief is both incorrect and unhelpful. Yes, some treatments for prostate conditions can influence libido. Yes, some men experience changes in sensation, arousal, or performance when taking certain medications. But those effects are not guaranteed, and they are often manageable when addressed properly. Let's take one example. 5-alpha reductase inhibitors, such as finasteride or dutasteride, are commonly prescribed for BPH. They work by reducing levels of a hormone called dihydrotestosterone, or DHT, which plays a role in prostate growth. However, lowering DHT can also reduce libido in some men, especially if testosterone levels are already borderline or low to begin with. The result? A man takes a medication to help with urinary symptoms, but feels like his desire or performance is changed and doesn't understand why. This isn't because something went wrong. It's because there's an interconnected system at work. Your prostate, your hormones, your nervous system, and even your emotional health are not separate silos. They're part of a shared network, and when one piece shifts, the others often respond. Now here's something many men find encouraging. A 2021 study from the Cleveland Clinic found that men who reported more frequent ejaculation, 21 or more times per month, had a significantly lower risk of developing prostate cancer compared to those who ejaculated less frequently. That same study echoed earlier findings from Harvard researchers who concluded that regular ejaculation may help maintain healthier prostate tissue by reducing inflammation and promoting better circulation. But this isn't just about cancer risk. It's also about maintaining a healthy hormonal rhythm. Here's another common misunderstanding: that prostate cancer treatment, especially surgery or hormone therapy, permanently ends sexual interest. Again, the truth is more complex. It's true that androgen deprivation therapy, ADT, which lowers testosterone to slow cancer growth, can suppress libido. It's also true that radical prostatectomy, surgical removal of the prostate, can affect nerve pathways tied to erection and sensation. But many men recover function with time, support, and proper treatment, including pelvic physical therapy, medications, and when appropriate, testosterone replacement under supervision. The key point here is that none of this is black and white. It's not a simple switch that turns off your libido the moment your prostate changes. It's more like a series of dials, and understanding how those dials interact is where you gain power. Also worth noting, the emotional dimension. Urinary symptoms, especially when they involve urgency or leakage, can quietly affect how a man sees himself. That can influence confidence, which in turn can affect intimacy. This isn't just psychological, it's biochemical. When you feel anxious, your body produces stress hormones like cortisol, which can lower testosterone and dull desire. So when men say they've lost interest for no reason, often there is a reason. It just hasn't been explained clearly. What you've heard over the years, that desire fades with age, that prostate problems end intimacy, that libido loss is inevitable, is incomplete. It doesn't reflect the real science. It doesn't reflect what we see in well-studied clinical settings. And it doesn't reflect the experience of men who learn to work with their bodies, not against them. But that's not the full picture. We'll explain why soon. So now that we've cleared up some common myths, let's take a closer look at what's actually happening inside your body, especially after 60, and how that impacts both your prostate health and your sex drive. Because it's not just about getting older. It's about how the systems in your body, your hormones, your nervous system, your blood flow, and even your mental state begin to interact differently over time. Let's start with testosterone. It's a hormone that plays a key role in energy, muscle mass, mood, and yes, libido. After around age 30, testosterone begins to decline gradually, about 1% per year on average. By the time a man reaches 60 or 70, that slow, steady drop can start to produce more noticeable effects. But here's the key: testosterone doesn't act alone. Your prostate is deeply influenced by this hormone, and it also plays a role in how testosterone is metabolized and converted into other hormones like DHT, dihydrotestosterone. In fact, DHT is more potent than testosterone in terms of its effects on prostate tissue, which is why medications like finasteride work by reducing DHT levels to help shrink an enlarged prostate. But here's where things get complicated. When DHT drops, some men experience a reduction in sexual desire, arousal, or sensation. So the very system that helps manage prostate growth, especially in cases of BPH, can also affect libido. Now layer in blood flow. Healthy sexual function depends on healthy circulation. That includes the small blood vessels that supply the pelvic region. As men age, and especially if there's high blood pressure, diabetes, or cholesterol buildup, those vessels may not deliver blood as efficiently. That can impact not just performance, but interest, because libido is strongly tied to how well your brain and body can communicate through nerves and blood flow. Speaking of nerves, the prostate sits near a complex web of nerve fibers that control both urinary function and sexual sensation. When the prostate becomes enlarged or inflamed, it can put physical pressure on these nerves. That pressure may not be painful, but it can disrupt communication between the brain and the pelvic organs, dulling sexual sensation or affecting arousal. Now, let's talk about urinary symptoms. If you're frequently running to the bathroom, waking up multiple times per night, or feeling like you never fully empty your bladder, it's not just inconvenient, it's exhausting. And over time, it can quietly chip away at your confidence. You might start to avoid situations that could lead to embarrassment. You may feel less inclined toward intimacy because of anxiety around urgency, leakage, or discomfort. That kind of emotional feedback loop is powerful and very real. A man is in good general health, but he's dealing with moderate BPH. He's waking up twice a night, and intimacy with his partner has declined. He doesn't feel in the mood, and when he does, it's inconsistent. When we assess further, we find his testosterone is slightly low, and he's only sleeping 5 to 6 hours per night due to frequent urination. The result is a perfect storm: hormonal disruption, poor sleep, nervous system fatigue, and emotional disengagement. None of this is about willpower. It's about biology. And here's the part most men find reassuring. You're not broken. You're adapting. Your body is still working. It's just speaking a new language. The signals might be quieter or more confusing, but they're there. And once you understand how those systems are linked — hormones, nerves, blood vessels, emotional cues — you can begin to work with them instead of against them. Even mental health plays a role here. Chronic stress, depression, and anxiety, all of which are more common in men facing health changes, can lower libido by disrupting the hypothalamic pituitary gonadal axis. That's the system that regulates testosterone and other key hormones. So if you're under stress, not sleeping well, and worried about your urinary symptoms, it's not surprising that desire feels distant. And if you're on medications that alter hormone balance, or have had procedures that affected nerve sensitivity, your body might still be adjusting. It's not your fault, but it is your body talking to you. And it's telling you something important: that these changes are connected, not isolated. That addressing one part, like sleep or urinary health or hormones, can positively influence the others. Men who improve their sleep, even without changing medication or testosterone levels, often notice better energy and mood within weeks. That, in turn, improves their interest in intimacy and their confidence. Because everything is linked. It's not a mystery. It's a network. This leads directly into the steps we'll share in just a moment, and they're simpler than you might think. They don't require major overhauls. Let's begin with something foundational. 1. Support your testosterone naturally. Your testosterone level doesn't just affect libido. It plays a role in your energy, mood, muscle tone, and even how well your prostate functions. That's why keeping your testosterone within a healthy range, even in your 60s and beyond, can help stabilize both your desire and your urinary health. So what can you do to support it? Start with nutrition. A balanced diet rich in whole foods, including healthy fats, lean proteins, and plenty of green vegetables, supports hormone production and reduces systemic inflammation. In particular, foods rich in zinc, like pumpkin seeds, shellfish, and legumes, and magnesium, such as spinach, almonds, and dark chocolate in moderation, may support testosterone synthesis. Next is sleep. Aim for 7 to 8 hours of uninterrupted sleep per night. Poor or fragmented sleep, especially due to nighttime urination, can lead to lower testosterone levels within just a few nights. Then there's resistance-based exercise, like weight training. Studies have shown that even moderate strength training a few times per week can naturally increase testosterone levels in older men, while also improving circulation and metabolic health. And finally, medical supervision. If your testosterone is clinically low and causing symptoms, your doctor may discuss whether hormone therapy is appropriate. This is never a one-size-fits-all decision, but when done safely, it can make a real difference. 2. Understand your medications. This is something many men overlook, but it matters. Some prostate medications can reduce levels of DHT, which may help shrink the prostate, but can also reduce libido in certain men. Other drugs, such as some alpha blockers, may cause side effects. These aren't reasons to stop treatment, but they are reasons to have a conversation. If you've noticed changes in libido, energy, or sensation after starting a new medication, bring it up with your doctor. There may be alternate options, different dosages, or complementary strategies to help balance side effects. Remember, you don't have to choose between your urinary health or well-being. With the right medical guidance, both can be managed together. 3. Maintain regular ejaculation. This may surprise some viewers, but the data here is strong and consistent. A landmark study from Harvard, followed by additional research from the Cleveland Clinic, found that men who ejaculated 21 or more times per month had a significantly lower risk of prostate cancer than those who did so less frequently. Now, to be clear, this doesn't mean there's a magic number, but it does suggest that regular sexual activity, whether through intimacy or self-care, helps maintain healthy prostate function, supports pelvic blood flow, and reinforces a positive feedback loop for libido. Because these actions involve not just hormones, but nerve stimulation, vascular engagement, and mental focus, all of which support your body. 4. Address urinary symptoms early. Many men wait too long to bring up urinary problems, and by the time they do, the symptoms are interfering with sleep, mood, and intimacy. But early treatment is often simpler and more effective. Whether it's frequent urination, difficulty starting, incomplete emptying, or getting up at night, don't ignore it. These symptoms are often signs of benign prostatic hyperplasia, BPH, which can be managed through a combination of lifestyle adjustments, medication, or, in some cases, minimally invasive procedures. And when urinary symptoms improve, so does quality of life, including sleep, confidence, and often libido. You may find you're not as tired, you're more rested, and you're not as worried about sudden urgency or discomfort, all of which helps your body return to a more balanced state. 5. Manage stress and emotional health. This might be the most overlooked piece of all. Chronic stress, whether from work, relationships, finances, or even your health concerns, can suppress testosterone and blunt libido. It also increases cortisol, a hormone that counteracts many of testosterone's beneficial effects. Add to that the emotional impact of dealing with urinary problems or changes in intimacy, and it's no wonder so many men begin to feel withdrawn or discouraged. The good news? There are real, proven ways to reduce stress and support mental well-being. Prioritize daily movement. Even walking can lower stress hormones. Practice deep breathing or short meditation sessions, which help regulate the nervous system. Stay socially connected. Isolation tends to worsen libido issues, not protect against them. And if you're struggling emotionally, talk to someone. A therapist, a doctor, a trusted confidant. Mental health is just as important as physical health. When men begin to address stress intentionally, even in small ways, their entire system often responds. Energy improves, motivation returns, and in many cases, so does interest in intimacy. Now, none of these changes are instant. It's not about fixing everything overnight. It's about smart, consistent action taken with respect for your body and where you are in life. You don't need to do everything at once. Start with one area, whether it's sleep, food, activity, or a medication check, and build from there. And above all, remember, this is not the end of anything. Your health, your energy, and your drive can still be supported, and you're not alone in navigating it. And always remember, all information provided in this video and channel is for educational and informational purposes only. Always consult a medical professional about your specific circumstances and before making any changes to your lifestyle, diet, supplements, or medication.